Good afternoon, esteemed audience. We'll be talking on OR setup in robotic pelvic surgery. The trick to a smooth show lies backstage. The elements discussed will be OT overlay, draping, instruments, patient positioning, port placement, and docking. The first need is a dedicated OR setup with enough space to allow docking from various angles and a recording system for documentation. This is what an organized OT setup looks like. There is a secluded space for console surgeon with adequate space for patient cart, OT table, anesthetist, and assistants and trolleys. The panoramic view of the OR room shows enough space for traffic movement, streamlined anesthesia, and patient table, with ample space for multiple trolleys for instrumentation as well as anesthesia. The first thing while preparing the robot is instrument arm draping. All steps are standardized from the day of inception to increase the changeover time efficiency. Position the arm for draping. Prepare the drape. Place and attach drape to the front of the arm. Move the drape along the arm towards the central column. Seat cannula molding and adjust flexi strips. Attach all drape straps. Move the draped arm. Now we take you through a running video of instrument arm draping. The drape is placed on the positioned arm and the adapter fixed. It is necessary to see all the levers moving to confirm proper adapter settings. The drape is moved towards the central column. Flexi strips adjusted. Drape strapped. And prepared arm moved aside. Now coming to the central camera arm draping, we repeat the drill with a few modifications. Position the arm for draping. Prepare the drape. Place and attach drape to the front of the arm. Move the drape along the arm and connect Velcro tabs. Seat cannula molding and adjust flexi strips. Attach drape straps. Move draped arm towards the central column to maintain sterility and open up the space for remaining arms. The video shows the drape being placed over the camera arm and adapter being placed in the arm socket. The drape is unrolled over the arm and flexi strips adjusted. The drape strapped and the arm adjusted. The drill is repeated for remaining robotic arms. Now dealing with the draping of camera head assembly. Prepare the drape. Attach the drape to camera head. Drape the camera head and camera cable. Attach the scope to sterile adapter. The video shows the drape being attached to the camera head, which is now locked clockwise. The camera head and camera cable is draped in a sterile fashion. And cable attached to the side of the trolley lest it dangles and falls. The scope is attached to the sterile adapter. Calibrated and white balanced. Talking about the instruments briefly. We have the monopolar curved scissors and the permanent cautery hook as unipolar cautery sources, usually used in right robotic arm. We have the Maryland forceps and the fenestrated bipolar forceps as an option to be used in the left robotic arm for bipolar energy. The Pro Grasp is an atraumatic grasper used in the fourth arm, usually for retractions during the surgery. And then we have the large needle driver for stitching and reconstructions during the surgery. For pelvic surgeries, the classical steep Trendelenburg position is used, which helps deflect the bowel out of the surgical field. This positioning merits some precautions. The arms should be adequately padded and tucked by the sides. The cross straps must admit 4 fingers beneath to prevent respiratory compromise. The cross straps should come by the sides of the shoulders and never above to prevent brachial plexus injuries. Port positioning in pelvic surgeries is standardized. The camera port is 12 mm and placed periumbilically. The 3 robotic ports are 8 mm. The right and the left working ports are mirror images and the fourth arm is placed above and medial to the anterior superior iliac spine. There is a 12 mm assistant port in right iliac fossa and a 5 mm assistant port between the camera port and right robotic arm for suction. A few considerations in port placements are as follows. Camera trocar should be placed 15 to 18 cm from target anatomy for optimal visualization. Secondary trocars are placed under laparoscopic vision. Robotic trocars for pelvic surgery come in sizes of 8 and 5 mm with blunt and sharp obturators. Cannula should be inserted up to black band, which acts as the pivot point for robotic instruments. Robotic trocars should be placed 8 to 10 cm away from camera port to avoid instrument clashes. Angle created by robotic and camera trocars should be greater than 90 degrees to increase instrument arm maneuverability. An optimal docking would entail: for positioning the camera arm, set up joint 2 opposite of arm 3 for enhanced maneuverability. The sweet spot on the camera arm must align. Align clutch button, third setup joint and central column maintaining sweet spot. For positioning the instrument arm, position number and sterile adapter facing forwards. There should be approximately 45-degree angle between each arm. Elevate the arms to avoid hitting the patient during docking. During the patient cart docking, establish steep Trendelenburg position. Align patient cart tower, camera arm and target anatomy. S systems have both motor drive and manual option for docking. As an instrument arm is connected to a trocar, motor drive brakes automatically. Table should be locked once robot is docked. Use the robotic arm clutch for gross movements in docking and the camera or instrument clutch to adjust the fine trajectory of the arm. Exclusive use of a camera clutch will limit the range of motion of the camera during surgery. In S systems, snap-mounted devices are used to engage the robotic trocars. This is the look of an ideal docked camera and instrument arm. The video shows aligned sweet spot with camera arm docking, followed by instrument arm docking to the robotic trocar with the snap-mounted devices. Checklist once docked. There should be proper working distance between arms. Arms should not compress against the patient. Straighten the instrument wrist before placing the tip into the trocar. Slide the instruments under direct vision. While withdrawing the instrument, straighten the instrument tips. With a detailed backstage preparation, one is assured of a master's knock. Thank you.